Hey guys, it's Nurse Gwenny. Let's talk about the lab value creatine kinase. We're just going to call it CK for short. CK is an enzyme, and enzymes are converters that take something from an unusable thing, convert it into a usable thing. Now we have three different flavors of CK. There's one that's specific to brain, there's one that's specific to our heart, and there's one that's specific to skeletal muscle. And that's the one we really care about. Time out. Let's take a rabbit trail back into history. We actually used to look at CKMB, the one that's specific to heart, for signs of a myocardial infarction, but now we have troponins, and that's all we really look at in signs of an MI in our patients. So now we really just focus on the one that is specific to skeletal muscle, and we see this elevate, and it elevates significantly, like we don't even care until it's 1,000. In any time we have cell rupture or destruction of that skeletal muscle, so a crush injury, a patient that fell and laid on the floor for 3 days until anybody found them, exertional rhabdomyolysis, anything that's going to squish those cells, because what's going to cause that CK to be in the bloodstream? Yeah, well, we got to know where it is first. So that converter, right, it's works to convert things in the energy creation process. It helps to produce ATP. Well, where does that happen? Yeah, the mitochondria, powerhouse of the cell. And so there's actually some of it that hangs out in the cytoplasm, which is cellular juice, right? But when we get destruction of that cellular tissue, whether it's a crush injury or rhabdomyolysis or a fall that laid there for 3 days, then that CK leaks out of the mitochondria and the cytoplasm and now is in the patient's bloodstream. So we really look at it in rhabdomyolysis. Those patients can have mild rhabdo, starts at 5,000, but I've seen patients with a CK of 100,000, and that is really severe rhabdomyolysis. So there you have it, CK, it's an enzyme, and we're looking for elevations anytime we have skeletal muscle destruction.